Assalamu alaikum guys, today we're going to talk about the appendix and why do we go for the operation procedure when the appendix is actually getting inflamed or infected. What is the reason behind and what is the story behind? So let's know first of all what is appendix. It is simple a tube-like structure that is actually located in the start of the large intestine. We have first of all esophagus, then we have stomach, then there is the small intestine. At the point where small intestine ends, there is the start of the large intestine. Here we get a tube-like structure that is known as appendix. And this appendix has got a function in our ancestors. So this was also called, and this is also called till now, the vestigial organ. Means it has no functions at all in our body. But this is actually not a complete discussion. It has got certain important functions in our body. So what are the functions? The very first point, for a smooth movement of something, if you want to have a smooth movement of some things, we must have smooth surfaces. Okay, so our gut, especially our large intestine, when this is not smooth enough, so the bowels will not be moving smoothly from our body. We may feel constipation and some other problems in our bowel, in our intestine, in our gut. Okay, so this particular organ, that is the appendix, this is actually secreting some lubricants. Now that lubricant is actually responsible to smoothen the surface of the large intestine, which helps to facilitate the movement of the bowel in the large intestine. So smooth bowel movement is actually being attained by means of the appendix. So this is the very first function of the appendix. It is helping in smooth bowel movement. Number two, very important functions. It is also secreting some antibacterial or antibiotic fluid. Now that antibiotic-like fluid or antibacterial fluid is actually responsible to fight against the harmful bacteria. So the second point is actually it is helping in maintaining the immune system of our gut. Okay, so gut's immunity and smooth bowel movement is actually achieved by means of the appendix. Now what happens when this is actually inflamed or infected? The reason behind is that actually if we have our diet, and our diet is actually poor in the fiber, so what happens, the stuff that we have eaten, that actually starts moving very slowly in the large intestine. So we know that we have certain pockets in the large intestine, so that those pockets are responsible to give a stay to the food that we have eaten. If food is actually exposed to a warm environment for a long period of time, putrefaction starts, means decaying of the food starts. So what this appendix actually helps is that it is releasing the fluid, the liquid, lubricating agents, lubricants, and along with that it is also releasing some antibacterial fluid. Now that is responsible to fight against the harmful bacteria. So what will happen then? Smooth bowel movement and smooth GI. So now what happens if we do not take proper food? Means our food habits are very rough and we do not include the fibers in our food. So what happens then? Then the load on the gut is increased. The same load is also increased on the appendix, and the appendix starts doing its job more and more. So overactivity of the appendix leads towards the inflammation of this. So we call that condition as appendicitis. And what we do then? We just go for the operation then, and when it is removed, then a person is actually having a healthy life. So we do have some important functions of the vestigial organ called appendix. Okay, so we better don't call it vestigial organ. It is actually having important functions. So that is all from my side regarding the appendix. I hope you got. If still you have confusions or questions, you can drop in the comment box, and don't forget telling your friends about the Dr. UUT lectures, and do share if this piece of information was helpful for you guys. Thank you for watching Dr. UUT lectures.